An antiviral drug has shown great promise in speeding up the recovery time for COVID-19 patients in South Carolina and around the world.
But our Abby O'Brien found out some Lowcountry doctors say the demand for Remdesivir is much higher than what they have.
Rural Williamsburg County has that small town feel that comes with a sense of community. But there's only one hospital in the county, and Dr. Troy Gamble says it's been at or near capacity for weeks.
Being a small town, our peak uptick of COVID has peaked later than most places.
Staff at the hospital have borrowed ventilators from other hospitals and often can't use all their beds because of a nursing shortage.
It's a tough time.
Despite the hospital's size, Dr. Gamble has been able to use the promising antiviral drug Remdesivir to treat COVID-19 patients.
Right now, there is only one antiviral, and that is Remdesivir that actually fights the virus itself.
Jot McGill was one of his patients who responded well to the drug after being diagnosed with COVID-19 and developing pneumonia in both lungs.
Terrible headaches, high fever, just body aches and pain, very uncomfortable. While I was in the hospital, I was given the Remdesivir, and within 48 hours, I was responding to it. So that's probably what saved me, and catching it early.
The FDA approved the drug for emergency use after it was shown to improve recovery times for COVID-19 patients.
Finally, we have an antiviral that seems to work, at least in most cases, if we can get people early enough in their course. Now, later in their course, when they get such bad pneumonia, nothing seems to work.
While the drug is promising, Dr. Gamble says there is a concerning nationwide shortage. On the day I spoke with him, the hospital ran out.
We have already used our 2-week allotment, so I have to go now from Wednesday to next Monday before we'll have any more Remdesivir. And that becomes critical when you have people that you need to, the earlier they get it, the better they do.
The South Carolina Department of Health and Environmental Control manages the distribution of Remdesivir. The latest numbers show DHEC has given out nearly 3,000 treatment courses around the state. More than 450 of those went to the Lowcountry region, and more than 650 went to the PD.
This is such a new drug, and it's being produced, but only so much can be produced today. And right now, the demand outstrips the supply, so it's a very worrisome shortage.
Dr. Gamble says he's lost patients to the virus, and his staff are working overtime to treat as many as they can, but they have hope in this drug.
Jot made a beautiful recovery, and we're just happy to have him here with us today doing so well.
And the people in Williamsburg County have stepped up to raise money to buy more intubation shields, glass doors for the COVID-19 unit, and 2 more ventilators for the hospital.
With the excellent health care here and catching it in time, and the drugs, Remdesivir, is the reason I'm here talking to you today.
I spoke with doctors at other hospitals around our area to find out how they're using the drug. We know MUSC is using it, and doctors at Roper St. Francis Healthcare say while there is a nationwide shortage, they've had enough on hand to treat patients who need it. DHEC is also working with hospitals around our state to get accurate data on patient outcomes after using Remdesivir. Reporting in Williamsburg County, Abby O'Brien, Live 5 News.